Hello all, I am Dr. Satyanarayan from VS Hospital, Chennai. I'm a physician and diabetologist. Today I'm going to talk about complications of diabetes. As you all know that we have a type 1 diabetes, type 2 diabetes. All these patients are prone for diabetic related complications. So you have to know what are the diabetic related complications that occurs. Diabetes is a disease where it affects almost all the parts of the body. So from head to toe. So you have to know what are the major complications arising out of diabetes. So when it comes to the brain, there is more prone for strokes. They call as a transient ischemic attack, or even they will have a complete cerebrovascular accident. So that is one common symptom. Otherwise, another common is visual disturbance. That's called as a diabetic retinopathy. All these patients with diabetes who are having, you have to go to a frequent eye checkup at least once in a year. You have to go and see your eye doctor, ophthalmologist, to check your retina if there is any bleeding in the retina or if there is any scars in the retina to prevent further visual damage. So these are the very, very important things. Next comes the heart. So most of the diabetic patients are prone for coronary artery disease, otherwise called as ischemic heart disease. If there is any ECG changes, if you could see in your routine master checkup or routine examinations, or if you're having any chest discomfort, any difficulty in breathing or a slight pain in the chest on and off repeated, please do not ignore. You have to go and see your physician or a cardiologist to evaluate further and to treat it accordingly. So that is another major complications arising out of diabetes. Next is the kidneys. So as you all know that diabetic related kidney disease are on a rise. So most of them they are quite silent sometimes. They will not be able to identify it. So if you are diabetic, you may have to do a routine test regularly. You have to frequently monitor your kidney functions. If there is any changes in the kidney functions, or if you are passing more protein in the urine, if your routine test shows there's more protein in the urine, that means you are having a diabetic related kidney disease or starting stage, or those things can be reversed back when if it is intervened early. So that is one of the major complications, because in the end you may land up in a complete renal failure, or which may require renal transplant. As you all know that getting a renal transplant is quite difficult. You may not get organs immediately. There's a lot of protocol. So prevention of renal disease is more important. So you have to be monitoring regularly. Then comes the peripheral vascular disease. That means blood supply going to the lower limbs. As you all know that diabetic patients, you must have heard that patients are having pain while walking, or they may have a gangrene of the foot, gangrene of the toes. They may lose their toes or limbs. Some of them are they're losing limbs. So like heart disease blocking the blood vessels, the same complications can occur in the lower limb vessels. So they may land up with amputation. So in case if you are having pain while walking, or if there is any discolorations of the toes, immediately seek the medical attention so that the further damage can be prevented. Not the least, but the patients with diabetes will have a diabetic foot related disease. Most of them, you will have heard that they're having pricking sensations, burning sensations. They don't have senses of their feet. So different symptoms they come out, that is called diabetic neuropathy. So these can also be reversed if it all we treat that earlier, keeping your blood sugars under control. Most of the complications arising out of diabetes can be controlled. We can have it within our control. So prevention is better than cure. So check your blood sugars regularly. You can prevent the major organ damage. Thank you.
VS Hospitals. Care, cure and compassion.